Imagine if I told you that one of the most powerful tools in medical history isn't a tool at all. What if the next breakthrough in medicine isn't waiting in a lab, but has been growing right outside our windows for thousands of years? And what if I told you that this natural miracle was once so valued, it was actually illegal to build a hospital without it? In 1860, if you tried to build a hospital without a garden in many parts of Europe, you wouldn't just face criticism, you'd face criminal charges. Today that sounds absurd, but by the end of this video, you might be wondering why we ever stopped. This is the story of how we discovered, and then forgot, one of the most powerful healing tools in medical history, and why its return might just revolutionize modern medicine. But first, we need to solve a mystery. Across every ancient civilization, from Egypt to Greece, from Persia to China, hospitals shared one bizarre feature. Despite having completely different medical theories, different gods, different healing practices, they all insisted on having gardens. Why? What did they know that we forgot? The answer would remain buried for thousands of years, until a groundbreaking discovery in 2018. Scientists at the University of Michigan made a stunning finding. Certain organic compounds released by soil bacteria can be as effective at reducing inflammation as leading anti-inflammatory drugs. Our ancestors weren't just guessing. They were onto something profound. But this was just the beginning. Enter Florence Nightingale, but not the Florence Nightingale you think you know. While most remember her as the lady with the lamp, she was actually one of history's first medical statisticians, and she made a discovery that would shock modern doctors. During the Crimean War, she found that patients near windows recovered 300% faster than those away from them. But it wasn't just about the light. Her data showed something even more remarkable. Patients with garden views needed less pain medication, developed fewer infections, and recovered faster than those without, even when everything else was identical. Today, neuroscience finally explains why, and it's revolutionizing how we think about healing. Here's where things get truly mind-blowing. In a groundbreaking 2019 study, researchers found that even looking at images of nature could speed up wound healing by up to 8.5%. But the real shock came when they studied what happens to our brains in natural environments. 3 minutes in a garden setting triggers the same patterns of brain activity as some of our most powerful anti-anxiety medications, but without any side effects. In fact, hospital gardens have been shown to reduce pain medication needs by up to 22%, speed up post-surgical recovery by 11%, lower blood pressure in 95% of patients, reduce stress hormones by up to 60%, and here's the kicker, it works on doctors too. So why did we stop? The answer might make you angry. In the 1950s, a perfect storm hit healthcare. The rise of air conditioning, the boom in pharmaceutical research, and most importantly, real estate prices. Suddenly, gardens were seen as wasted space. The same healing spaces that were once mandatory were now considered luxury items. The cost? A 35% increase in recovery times for certain procedures. But here's where the story takes an unexpected turn. Some of the world's leading hospitals are bringing gardens back. Not out of nostalgia, but because of hard science. At the Singapore General Hospital, the introduction of therapeutic gardens led to something extraordinary. A 45% reduction in post-surgical complications. And they're not alone. From Stockholm to Stanford, hospitals are rediscovering what our ancestors knew all along. So here's the question. What if our ancestors weren't primitive? What if they were pioneers? What if the hospital of the future isn't just about better technology, but about remembering what we forgot? Because sometimes the most powerful medicine doesn't come from a lab. Sometimes it grows right outside our window. The only question is, how many more patients need to recover more slowly before we remember what we once knew?